Welcome again to this webinar. My name is Marcio Galiato. I am a member of MHPSS.net. I want to welcome everyone for this webinar that we are starting now. So basically, I will explain again a few elements of this webinar. You have on your left side of your screen a chat box where we can post your comments. You can introduce yourself. And during the webinar is the space where you can put your question. We just recommend that your question, based on previous webinars experience we had, you can make your question short and clear, avoiding using acronyms as well. All these questions will be later at the end of the presentation. We will post again to Leslie and Zainab. Okay. I have here the pleasure to welcome you and also to welcome and say with many thanks to Leslie and Zainab. They are both very dear colleagues and also dear friends that we have the pleasure at MHPSS.net to receive them. So today we have, let me put here the presentation. Today is the initial, it's when we have a series of actions related to the launching of the community-based MHPSS guidelines from UNICEF. We are starting with this action today to have this open webinar where it is giving a roadmap of what is about to be launched. I have here the pleasure to introduce to you Zainab, which is the head of the MHPSS unit in New York for UNICEF, and also Leslie Snyder, which is now based in Copenhagen, and they both have been part of writing these very important guidelines that so many people are expecting. So straight, we are going to start the presentation. I will hand over to Zainab and Leslie. They will exchange, they will shift from each other during the presentations. They are doing the presentation together, which should last for about the whole webinar for about 1 hour. Zainab, I'm unmuting you. And the floor is yours.
Thank you, Marcio. Thank you, Marcio. And to the entire MHPSS.net team, Renata, Ananda, Tasha, for organizing and hosting this session. Hello, everyone. It's great to see you all here. Thank you for joining. As Marcio mentioned, my name is Zainab Hijazi. Some of you may know me from my previous work with International Medical Corps, but as of June of this year, I've joined UNICEF's Child Protection and Emergencies Unit in New York as the MHPSS specialist. I initially played a small supporting role to Leslie, who joins me today in the development of the UNICEF Community-based MHPSS operational guidelines. But in my new role with UNICEF, I'm truly honored to now be leading the process for their release as a field test version and taking the initial steps for planning the upcoming pilot phase. Leslie?
Okay. Hi, everyone. It's great to see all of the friends and colleagues who've joined, and thanks, Zainab, for inviting me to join you on the webinar. Yes, we both worked on this as consultants a couple of years ago, and I'm currently with Save the Children Denmark, who is hosting the Global Center for Child and Family MHPSS. So I've recently come on board as the director of that center. Zainab, I'll hand back to you.
All right, so as you know, we're here today to provide you with an overview of the soon-to-be launched field test version of the UNICEF Community-based MHPSS operational guidelines. It's a mouthful. So what we'll be doing is providing updates on the development process to date and give you an overview of the content and then establish together some steps forward in rolling out a field testing phase that will further inform content, structure, layout, and use of the guidelines. So these guidelines were, they build on lessons learned of MHPSS programming that support a focus on community engagement and system strengthening when designing or implementing programming for children and families. The guidelines were informed by an evidence and practice review of MHPSS programming for children that was conducted in 2015. And really they aim to address the unique challenges that today's crises pose for children's safety, well-being, and optimal development. So what we do know is that while child-friendly spaces have shown very positive outcomes among children, we also know that models that center only on child-friendly spaces have demonstrated certain limitations in engaging families and communities, as well as in transitioning early emergency response to recovery and long-term development. And so there was really a need to develop operational guidelines specifically targeting agencies working with children that offer practical information and tools to implement a range of evidence-informed MHPSS interventions, and of course linked with mental health interventions for those in need of more specialized support. So the process for development of the guidelines initiated back in 2015 following the Interagency Standing Committee MHPSS Reference Group annual meeting. Different channels of feedback were established to collect input and feedback on multiple drafts, which this included feedback from UNICEF colleagues in various sectors and from UNICEF field level staff, in addition to technical revisions by members of the ISC Reference Group Community-based Psychosocial Working Group. What we have today is a version that is a product of these revisions and is now ready for field-level rollout and testing. We'll discuss the steps for piloting the guidelines towards the end of today's session. The guidelines, the operational guidelines aim to provide agencies who are working with children with practical information and tools to implement, evidence-informed MHPSS interventions that support and promote children's recovery, psychosocial well-being, and protection. But also, it also provides guidance on implementing a range of interventions that engage actors at all levels. And Leslie will walk us through some of the theoretical framework for the guidelines. But essentially, we are looking at interventions that engage actors at the level of children, caregivers, families, and community, and that aim to restore and strengthen family and community supports and systems. And of course, important to mention that the guidelines are also, of course, closely aligned with the work of the Child Protection Alliance and the Child Protection Area of Responsibility. So who are these guidelines intended for? As I mentioned, they are intended for UNICEF staff, for partners, but also all agencies who are designing or implementing MHPSS programming for children, youth, and families, specifically in humanitarian settings. But the guidelines are also useful to colleagues and partners working in child protection, health, WASH, education, and other sectors. You'll notice in the guideline that the guidelines actually include key recommendations informed by and I think supplement the ISC MHPSS guidelines specific action sheets on what non-MHPSS actors can do to promote mental health and psychosocial well-being for children and families. We'll also get to that section once we kind of go through the different content. So when talking about the structure of the guidelines and how they are structured, we can go back to just kind of mention that, what the guidelines aim to do is really provide an overview of community-based MHPSS. So the guidelines introduce the concept. We talk about the importance of networks of people and structures that surround children as part of the social ecological model. And the core of the guidelines is the section that guides the user on how to operationalize community-based MHPSS. It elaborates on, what we have called the 9 circles of support, and specific intervention strategies that can be implemented within the 3 tiers of the social ecological model. So children, caregivers and parents, families, and community. And as part of this more operational piece, there is specific guidance on monitoring and evaluation of MHPSS projects and community engagement and participation. And of course, this knowledge product would not be operational without a compendium of tools and resources across layers of the ISC MHPSS pyramid, and directly aligned actually with some of the interventions described in the operational section of the guidelines. And we'll also talk a little bit about the compendium and how it is included and referenced across the different sections in the guidelines. All right, now let's get into the section overviews, and I hand over to Leslie to walk us through it.
Composed up, and let me get to the next slide. So the guidelines begin by exploring what we mean by community-based MHPSS and its key elements. And for example, some of the things you'll find in that chapter is that it strengthens natural supports and systems. So this is to improve the overall care environment for children and families. And by strengthening natural supports and systems, it also links to non-humanitarian response and through the humanitarian development nexus. It also makes use of community knowledge and capacities, recognizing that families and communities are the first responders and they are the frontline people for children's care. It also requires skill and specific competencies, and these competencies can be taught and learned. And this is actually a very important point for the guidelines, and it also was an important point for the community-based working group to really acknowledge that this is challenging work. It requires skills to understand, analyze, and negotiate. Sometimes that's negotiating regarding local belief systems, ensuring do no harm in practices, and also being able to make the best use of local resources. Another point about what we mean by community-based MHPSS is that it involves the community in all phases of programming, so throughout the programming cycle, and ensuring that interventions don't undermine natural supports. It addresses interventions at all layers of the pyramid in an integrated way, and we're going to talk a little bit more about that, requiring functional referrals between layers, and looking also at the various entry points in the community for MHPSS interventions. Often when we think of children, we think of the entry point of schools, for example. And it includes both lay and professional services, and psychological and social supports. And it is important that lay and professional actors work together for seamless coverage of care in community-based models. The social ecological model is a framework that probably most of you are familiar with, and you've probably seen this, this model before. It illustrates the tiers of support that surround a child. So closest to them are the family and the primary caregivers, parents, if they have parents, with whom the child interacts the most, and who are on the front line of providing comfort, support, safety, and the opportunities for development and learning. The next circle is those in the community who are the next layer in terms of being close to the child. This is teachers, can be coaches, peers and friends, extended family, could also include healthcare workers and others that the child interfaces with. And all of this model is embedded within the larger culture and society. And it's important that this model is contextualized in each place where it is used, and to think about what culture, society, belief systems, and structures are in place in each context. And working through this model, the environment for everyone is actually strengthened, for the child, the family, and for all of the community. This is also a dynamic model, and we need to keep that in mind. There's an interplay between the various people and structures at all these levels, and that includes the active participation of children themselves, because they are also agents that influence their own ecosystem. Next on this slide, you can see the social ecological model operationalized into the 3 tiers. And that's visually done with the use of colors. So the first tier is the child, And it might be a little bit hard to read that, so I'll just give you a sense of what these 9 circles are. So under the child, we have number 1, safe and nurturing environments at home, in the school, and in the community. Number 2, positive relationships with caregivers, friends, teachers, other community members. Number 3 is opportunities for stimulation, learning, and skills development. Important to remember that's inclusive of children of all ages, genders, and abilities. In the next tier, we have the family and caregiver tier, the ones sort of closest to the child. Number 4, then, the 4th circle would be support for parent and caregiver well-being, coping, and recovery. So thinking about the well-being of the caregiver themselves. And this can include capacity building as well as focus care for parents who might themselves have mental, neurologic, or substance abuse disorders. It might include support for teachers. Number 5 is the knowledge and skills for parenting and support for children in distress. This can include also children who have higher level mental health needs. Number 6 is access to family and community support networks. For example, this could include facilitating the inclusion and participation of vulnerable families in community life. We move to the next tier, which is community, and the last 3 circles of support. So number 7 is the awareness of child and family well-being and protection needs. For example, so that communities can take positive action to reduce stigma, to ensure protective environments in the community for children, and that people are aware of child protection issues. Number 8 is activation of the natural community supports. For example, outreach to vulnerable families might fall under this circle. And number 9 is the strengthening of care systems for children and families. So that can include building the workforce of lay and professional care providers and ensuring functional systems and structures. And in this graphic, you can see that the 3 tiers, child, family, caregiver, and community, are operating across all layers of the IASC MHPSS pyramid in an integrated way. So all of the MHPSS approaches, no matter what the actual targeted program is, must be aware of the other layers and help children and families to access the services they need at each layer. Specific guidance for activities and approaches across each tier are outlined within the operational framework, and a lot of very practical examples are given for each layer of the pyramid. And this is where we can see how activities are implemented within the framework. In the first circle, you see these MHPSS approaches and specific activities that I just mentioned. And so we do hope that those practical examples are helpful for people to inspire them in their own programming, and probably things that a lot of you all are already doing. And UNICEF field practitioners and partners and others in the community can choose from these approaches in ways that align with the needs of children and families in their areas, that make best use of existing resources, and within also their programmatic aims. It was not exactly a menu, in that it would not be appropriate for any program to operate solely at one layer of the pyramid. MHPSS is really a composite term, and so we're conceptualizing this as a composite approach, so that any program must know its relationship and interface to the other layers, and be able to work in a system-wide way according to its own capacities. For example, you will have children with higher level mental health needs that will come to child-friendly spaces programming. So the CFS staff must be able to identify these children, have basic competencies to support them, and refer them when needed to higher level supports that have already been identified. And once children are receiving higher level services, for those who may need those, the CFS staff would then need to understand their condition and its treatment, support that, and also work with the child to remain an integral part of the activities in this child-friendly space. as well as supporting the caregivers. So this would be a concrete example of what we mean by being aware of and being able to operate at all levels according to what your own resourcing capacity is. In the last circle, you see the reference to the Compendium of Resources. So this is a very key resource document, and Zainab will tell more about this. It provides concrete examples also from a variety of contexts and organizations, and a lot of very rich reference material. Okay, monitoring and evaluation. The operational guidance contains a log frame and an M&E framework. This framework was adapted from the IASC MHPSS Common M&E framework, and as such, there are 5 key outcomes that have been adapted to better target children and families. But the language is very much aligned with the Common M&E framework, and there are also 6 related key impact indicators. Okay, there is another chapter, and this is an important section because this is the how-to on community engagement and participation. So as I said before, this is challenging work. It's worth the effort, but it does take effort. It does take some skill. So there is this chapter on community engagement and participation. It's how to work with communities, including the various steps involved and the principles that underpin this work. So when we think about the steps, it's learning about the context, identifying and meeting community stakeholders, and how do you do that in the most appropriate ways and respectful ways, conducting an inclusive participatory assessment of the needs and resources, facilitating inclusive participatory planning of solutions and interventions, supporting program implementation by community actors, and then monitoring and evaluating interventions together. So this chapter draws on some other resources that have been developed by other organizations such as UNHCR and others. So again, we hope that this is also a useful chapter in really learning how do you approach community work. And it's important to keep in mind that this is really about meaningful inclusion and participation of community members. It's not tokenism. It's really finding out the ways to do this so that people are meaningfully included and have a voice in how these interventions are designed, conceived, and rolled out. Also important in community work that community members that are engaged represent fairly the various members of that community, and finding ways to include groups who may not usually have a voice and need to be heard. We also have a list of annexes, and these contain some background information about this evolving humanitarian context that Zainab mentioned, and the UNICEF key commitments, frameworks, and standards that underpin the operational guidelines as a whole. The log frame is detailed in the annex together with means of verification for the indicators. There are also 3 case studies graciously shared by UNICEF program staff in South Sudan, in Nepal, and Lebanon, also together with the partners that they worked with. And finally, but very importantly, the last annex is about what other actors can do. So this is an annex related to the important issue of cross-sectoral mainstreaming of MHPSS approaches. And these are taken from the action sheets from the IASC guidelines. And I think, Zainab, that's over to you. Yes?
Thank you, Leslie. And so as mentioned earlier today, there is a compendium of resources that accompanies the guidelines. So this compendium provides useful resources at each layer of the IFC MHPSS pyramid. It includes training materials and manuals and tools and guidance documents from various organizations. The selection of these resources were based on a desk review of evidence-based resources and a wider review. It also includes supporting materials and field applications and adaptations of those resources when they are available. Examples of the resources from the compendium are indicated throughout the text in the guidelines, and more specifically in the section that Leslie described, which details MHPSS approaches and specific activities in each of the ISC pyramid layers. And most importantly, what we have decided is that the compendium will not be released as a PDF or a shareable soft copy. Rather, all resources have been uploaded to a group on MHPSS.net. I'm the administrator of that group and will be available to support and answer questions about use of the guidelines or locating specific resources in the online compendium, also supporting through a forum for discussion. A link to the group will be available through a dedicated page for the guidelines on MHPSS.net. You can see the link here on this slide. But of course, it will be circulated again once the page is made public, when the operational guidelines are launched in week of August 21st. So next steps. During the week of August 21st, UNICEF will launch the field test version of the operational guidelines on community-based MHPSS. And we'll initiate planning for field testing of the guidelines in multiple settings. And so let's talk a little bit about what this field testing will look like. So finalization of the guidelines, of course, will largely depend on outcomes from a field testing phase and the types of changes and improvements that we will need to make. What you can expect fairly soon is the development of orientation materials for field testing, which will also be made available through the MHPSS.net dedicated page for the guidelines. You can also expect to receive a call out for field testing through multiple channels, including the IAC MHPSS reference group mail out, UNICEF internally, and the Child Protection Alliance. We'll then, of course, wait to receive applications for field testing by agencies and establish a plan. What this plan will include is, one, implementing a combination of field level and online orientations on use of the guidelines. For designing, so whether you're designing MHPSS activities for children and families or you would just want to strengthen those activities, you would be eligible to participate in this field testing. But we'll, of course, provide more detail on that in the call out. And the field testing will also involve setting up of ongoing consultation meetings with and between the pilot agencies. And at the end of the field testing, we will consolidate feedback on the guidelines and develop an interagency review plan, which we will, of course, share more details on once we have it laid out. And we will, of course, then work towards their finalization. Now, what that time period looks like, we know that, we are launching the field test version fairly soon. The field testing will, of course, go into 2019. So as we kind of move forward in the field testing, and as I mentioned, as we kind of come to learn about the different changes and improvements that we would need to make to put these guidelines out in their final form, we will have kind of a better idea of when they will be, launched in their final form towards the end. And really, honestly, what we would love to hear from you is your thoughts on, what we've presented today, how you envision using the guidelines, if you think they can be helpful to your programming, and of course, if you have suggestions for us or would like to indicate your interest in participating in the field testing, really the floor is yours. We welcome any questions and are happy to answer any questions and details about the contents of the guidelines, but also the field testing phase and the what's to come following.
Thank you so much, Leslie and Zainab, for this thoughtful presentation. So we are receiving a few questions now. One first question from Amparo Aroquipa. What do you think about using mobile health services as a tool of monitoring the interventions? results of the social ecological model you have shared. Could you please share your opinion? Does that, do you understand the question, Zainab and Leslie? So basically, the use of mobile health services, as a tool for interventions in that regard. Are you making you both muted? So the floor is yours.
I'm not sure if I completely understand the question. Using mobile health services as a tool for monitoring. I think that mobile health services are very important in a lot of the areas where we work. Mobile as in. Perhaps can we clarify the question? Is it mobile?
Amparo, Aroquipa, if you can rephrase your question. And for the time being, Leslie, I will ask you, the two of you, other two questions here. One of them, it's how, what's the plan to transform the guidelines into operational action in humanitarian responses, especially considering the coordination mechanisms in terms of interagency field contexts. This is one question. And the other question I'm ready to start thinking is how the guidelines address or consider the field needs in terms of monitoring and evaluation mechanisms, more specifically related to what it offers in terms of indicators, which is a field debate that we have. It's an ongoing building, challenging reflection. So good luck.
Yeah. I'd like to say, and I'll take the second question perhaps, that I think that it is a challenging exercise to develop the common monitoring and evaluation framework. There were a lot of people that worked on this, and it's also a very important exercise because it's something that we really need to be clear about for our programming, to demonstrate impact, to be able to make improvements. And I think it's quite exciting what we've been learning over the last few years about our programs, how they're rolled out, and what impact they actually have, or what the absence of our programs might mean. So the Child-Friendly Spaces study had that kind of nuance in it, the multi-country study that was done. And I think for M&E, it's the common framework is beginning to give us a language that we can really use across countries. So we're very much hoping that that the one that we have here in the operational guidelines, because it is aligned with that common framework, will help in that coordinating and connecting of how we're learning about our programs and being able to report on those. So we have gone as far as developing the means of verification, and we did as much detail as we thought could be useful for people to be inspired from and then adapt within their own context. I don't know if that answers the question, I hope.
Yeah, and yeah, thank you, Leslie. And also to answer the question on the link between education and MHPSS and how education can contribute. So yeah, I mean, of course, what we know is that education serves a very critical role in reestablishing safety and structure in the lives of children. And you'll see throughout the guidelines, we talk a lot about the different channels through which you can implement mental health and psychosocial support activities for children, for youth, and also for families. And of course, school is a very important mode in which we would deliver such services. Specific interventions targeting children and youth, but also, of course, targeting caregivers and teachers. So the link is absolutely there. It's critical, and we try as much as possible to lay it out through the interventions that we suggest through the operational section of the guidelines. And also, you'll find, and this is something that Leslie talked about in her presentation as well, is the the ways in which education actors can also have a role in MHPSS, and that is also outlined in the guidelines based on the information that is also available to us through the MHPSS ISC guidelines.
Thank you both. So a lot of questions are coming.
Yeah, and
yes, I've just been reading. Sorry,
go ahead, Lizzie.
No, please finish your thoughts, and then I'll come to the other question.
No, I wanted to go back to the question about mobile services, and from what I understand from the question is, kind of how do we utilize outreach services? This was my understanding of the question. I hope I'm getting it right. But yeah, absolutely. I mean, outreach in a lot of places, we have to adapt to the context, to the different, to the situation, the resources that we have on the ground. And a lot of the times we have to rely on outreach type support and also linking on to services that are provided through the health sector. For example, when we have community health workers and we rely on these community health workers, one, to provide basic psychosocial support, and then also to kind of roll out also the different types of services and support systems. And I think your question was specifically on monitoring, and I'm not sure exactly what you meant by that, but from a monitoring perspective, of course, we also utilize the different channels. So wherever we have services, really you need to be monitoring what you are doing, and also as much as possible looking at outcomes and impact where possible. And Leslie talked about the log frame that was developed and the different indicators that we propose linked to the various activities and interventions.
Thank you very much. Go ahead, Leslie.
Thank you. I was just reading through some of the other questions, and what I'm seeing in there, in the questions, are a lot of practical examples, most of which I think and hope are included in these guidelines, are referenced there. So the link between education and MHPSS and how education can contribute to the well-being of children and communities. So an example that I can give you from the guidelines themselves is about working with the community to establish safe spaces and for children's access to quality structured activities, as well as to safe learning spaces, supporting young children's access to and participation in ECD activities, and inclusion and meaningful participation of vulnerable children, children with disabilities, for example, and direct support also for teachers. So that's in how the guidelines are structured, is really giving sort of practical examples at each layer of the pyramid, so that you can see where interventions fit in the framework and across children and then families, caregivers, and communities. And then as I read down, does the compendium contain a teaching framework for the training of lay counselors or for bolstering primary health care understanding of MHPSS? In terms of a competency framework, is not included in the main guidelines, but it is recommended to think about the need for lay and professional counselors and what competencies they need. Whether or not those are in the compendium, I will give over to Zainab.
Yeah, so in the compendium, we didn't develop any resources ourselves. Rather, we looked at the different resources that are out there. There is a lot on there about, training, paraprofessionals, non-specialists. So there are specific resources targeting lay workers. And also, as I mentioned, there are supplementary materials. So where there is a manual, for example, we made sure if there are accompanying, orientations on the use of that manual, it is there. So I know that there are also adaptations and field examples of how those different manuals were rolled out in the field. So that is included in the compendium itself. And I see a question from Teresa on whether there are special considerations for adolescents in the guidelines. And yes, absolutely. And that really what we do is throughout the guidelines, we're looking at the specific needs of adolescents, so older children and adolescents. Within the 9 circles of support that Leslie described, we have specific areas and outcomes specific to adolescents, and of course throughout the layers of intervention. And because the interventions are developed in such a way that they kind of fall under the different tiers, there are interventions specifically targeting adolescents that are suggested throughout. And of course also in the compendium itself there are specific resources that can be used to roll out these interventions with this specific group.
I also see another question here that I'd like to respond to, and it is how community-based MHPSS works in collaboration with the health system and services. And this is quite an important issue, but we've expanded that to be not only health system and services, but also social service systems. So thinking a bit more broadly, and how those two systems need to interact. And there are sort of very specific, again, actions around the interface with health professionals within community health centers, outreach workers, as well as higher levels of care, and also with social service systems, and how those need to be funded, linked together for functional referral systems. So you actually have recommendations. You'll find most of those under the community tier is where you'll find a lot of those actions that specifically focuses on systems and structures.
And I also see a question on specifically around people on the move. And what I will say is that while the guidelines can be kind of used across the different across different contexts in humanitarian settings, that a lot of the content actually relied, of course, on what we know works, on guidance, on ISC guidance where available, and there is, the guidance on the MHPSS support for refugees, asylum seekers, and migrants on the move in Europe, the multi-agency guidance notes. So we drew a lot from that as well. And of course, there is this section towards the end in the annex that describes the different types of emergencies and crises. So while and of course, Leslie can jump in, but we don't have specifics to people on the move, but it is something that can be adapted to those contexts and settings.
And I see questions here that relate to sort of coordinating with existing systems and structures, including health systems, and not duplicating and not undermining those. And that's actually one of the core principles around which the guidelines are based, is really working with the existing systems and shoring those up. And community-based MHPSS, I think that's really what it's about, is making best use of the existing resources.
And I see a question on, was wondering whether there would be a space or opportunities for junior mental health professionals to get involved in the piloting by Aranya. Yes, I mean, absolutely. I think what we hope to do through the field testing is field test in multiple settings, different contexts, by different, by different individuals and persons with different capacities. So yes, I think please, if you are interested, let us know. We'll circulate our contact information towards the end. And of course, as I mentioned earlier, there will be a call out for field testing that will go out officially. And we'll, of course, hope to expect an application from you for the field testing.
Thank you, Leslie.
Some questions related to, yeah. Sorry, I just see some questions related to the child protection minimum standards and to sort of parallel work that is going on. And I think it's really nice to begin to align these now that the guidelines are being released and we can share resources and coordinate. So really appreciate those messages coming from the Alliance and from others.
And I also see a message from Noor in Lebanon and a question about strengthening national systems. And it's great to receive this comment from you, actually, from Lebanon, because there is actually a case study that is included in the guidelines, specifically around Lebanon, and the amazing work that has been done through the National Mental Health Program at the Ministry of Health. The case study has been laid out in such a way that, we're looking at the application of the different principles and things like that that we've highlighted in the guidelines, and how that kind of transforms into reality and what that means. So I hope that the case study will actually provide a lot of information on system strengthening, specifically at national levels and with government. Have we missed any questions, Marcio?
No, I think you have done a pretty good job, the two of you, going through it directly. And I wanted just to say to the participants that before you leave, Ananda and Renata, they are putting the link to a standard evaluation we have for webinars. It is very important for us that when you leave the webinar room, you do answer that 5 minutes questionnaire, because it does provide a lot of important feedbacks for us for this webinar, but also to help us to design the future webinars.
And just to say also that the field test version will officially be launched in August, so in August, the week of August 21st. And as we promised, we will be sharing a draft of these guidelines with the participants of today's webinar. Of course, not for circulation, but we thought it would be a great opportunity for you, since you've received this, kind of orientation on what the guidelines look like and the field testing process moving forward. It will also give you a good opportunity for when the call out for field testing comes out, if you, to kind of convey your interest in being part of that field testing with us.
Thank you for that clarification, Zainab. I also just want to say to the participants that today we got the limited number of participants, and we received several messages that people trying to connect and join the room, but it was not possible. So I think it's an important feedback, because this doesn't happen often in our webinars, which shows the need, how the field is eager for this kind of instrument. We received 2 more questions here. One is related to what can we do for children with high need of specialized care in a context where there is no existing services for mental health services, specialized services. No? So in which way is, the guidelines contributes to address this need. And also a question from Bashir Saad. Can this package be used as part of the support in rehabilitation of former armed conflict combatants?
I can take the first question to start, and I think this is a challenge in many areas, and the community-based guidelines really look at the community as a whole, and what the resources are there that you can mobilize and activate. So where there might not be professionals, there may be other systems of support that can be mobilized. And at the same time, look about what needs there are for capacity building. The MHGAP has been a very important tool, for example, that can be included and is mentioned in the guidelines for starting to build that capacity with primary healthcare providers. So it has to take, and I think programming for MHPSS for children and families also has to take a longer term perspective, especially where you need to begin building these kinds of competencies, these kind of systems and structures in places where they don't exist. So what we're hoping is that the community-based focus that we have here is looking more broadly at what actually exists. What natural supports can you draw upon? How can you strengthen those? How can you reduce stigma in communities? And how can you then lay a roadmap for putting in the additional capacity that may be needed.
And on the question for, specifically around armed conflict, so I think that the answer to this is that the content and the guidelines drew as much as possible from the different multi-agency guidance notes that are available. We look at, very specifically, we look at, the very particular well-being and protection risks during, migration, during conflict. And we try as much as possible to kind of lay out some of the recommendations from these multi-agency guidance notes that are available to us, and kind of having a go-to. So this would be your go-to for recommendations that have been pulled from these different really important resources. So for example, within the scope of, armed conflict, we have recommendations around, how to help keep families together, identifying and protecting vulnerable children and caregivers, and then, and so on and so forth. So in answer to your question, yes, it does, it can support your programming. And hopefully you'll be able to kind of operationalize some of the the guidance and the recommendations and the guidelines through the interventions that we propose as well.
Thank you.
I think it might be, if I just might say, when I read some of the questions, for example, can this package or these packages be used for institutionalization of MHPSS services within the healthcare system? I think it might also be important to say what these guidelines are not, because we're getting questions that cover the range of how do I do this in my context with a lot of specific examples. So I don't think that it's not a toolkit, for example, on how do I do this from step A to step Z. It's more that these are guidelines and recommendations that can give an overview of what we're talking about with community-based MHPSS and how it can influence the strengthening of systems, the strengthening of communities to be able to meet MHPSS needs in really challenging environments. So I think what might be interesting for field testing, and maybe I'll put this also to Zanab, is to see what additional tools need to be developed or that are currently in development, because it can be that these recommendations highlight some gaps where we need some tools to be able to do this kind of stepwise implementation.
Yeah, absolutely. No, that's a very good clarification, and specifically with regards to MHPSS services within the healthcare system. So while the guidelines we, of course, promote, of course, in line with, WHO recommendations, the importance of integrating mental health into primary healthcare, for example, or within, general healthcare systems, we recommend those in the guidelines, and then what we do in the compendium, we include specific resources around that. What we don't know is provide that stepwise approach to kind of how you do it. Specifically within that sector, because of course there are existing resources also that are available that would aid you in doing so. So we want to make sure as well that we're not, kind of doing something over reinventing the wheel, rather kind of laying out the principles, and then where resources are available already exist to actually support you, we are making them available through the compendium and linking them to recommended interventions and actions that we lay out in the guidelines.
And along with that, just a note, when you see the guidelines, when you receive them, you'll see that those links to the compendium and to specific resources are throughout the document, so that it's easy to see, okay, I need that kind of a resource, and then you know that it's right there and it's easy to link to.
Yes, and hopefully now that the compendium is online, it will be something that we're updating regularly as resources become available to us, and making sure that it is a live document rather than something that we circulate once and that's it. Yeah.
Great. Well, I think we are starting to conclude the webinar. I want just to say that it is a pleasure to have the two of you here, Leslie and Zainab, this guideline is very much needed. It's showing the interest from the field by the number of people that join it, the expectations that they have, reflecting the needs that they are really questions that they are trying to answer. I was really also delighted to see some of those comments and questions, so, especially the ones that are pretty much inclined to answer the difficult aspect in the field operations, which is durable solutions, how to institutionalize MHPSS in systems, in countries, in policies. So the humanitarian response doesn't become dependent from humanitarian aid. So it is really, really interesting, and I'm so thankful for this self-oriented webinar that the two of you could provide. I want to say to the participants, many thanks as well for joining this webinar. We will be sending a draft version of the guidelines only for the participants that register for this webinar. It will be without the design. The one that's going to be a final version is going to be released in 2-3 weeks' time. This webinar is being recorded, and it will be available not straight after the webinar, but it will be available only when the webinar, when the guidelines is officially launched. So just to say that the group that is here is a privileged group. Zainab and Leslie, thank you very much. I don't know if you want to say any final words, and then we are concluding and closing the webinar room.
No, I just want to say thank you to everyone for joining. It's really been great to be able to kind of present these guidelines and what they and how, and I'm really hoping for a successful field testing phase that can further improve the guidelines and make sure that they really meet the needs of the field. And thank you to Leslie, who put in so much work into them, and we would not have them without her. So thank you so much, Leslie, as well.
And you, Zainab. It was not a small role you played, so thank you. And also, I find the list of questions really interesting, so I appreciate the thoughtfulness of those, and also as we move forward too with the Global Center for Child and Family MHPSS, how we can support the guidelines and the field testing and starting to address with others these really critical questions. So thank you.
Thanks.
And thank you, Marcio, MHPSS.net team, as always. Yes.
So thank you, everyone. I'm closing the webinar room now. And don't forget the exit survey. See you next time in the next webinar. Bye-bye.